Number 1, the elderly. Over the age of 65 have increased risk of a more severe form. Number 2, people that have lung disease, such as asthma, or people who smoke have increased risk too. If you've smoked in the past, you could have underlying emphysema or chronic obstructive pulmonary disease, or COPD, which increases your risk. Number 3, if you have heart disease and/or heart failure, many patients with heart failure can get fluid in their lungs, which makes any respiratory infection worse. Also, it's been discovered that the hearts of people who have high blood pressure or those who have had a previous heart attack are already working a little bit harder. Once these individuals get an infection like COVID-19, their hearts have to work even harder. Not to mention, the virus can cause inflammation of the heart muscle itself. All of this can cause abnormal heartbeats to develop or even a heart attack to occur, which can lead to death. Number 4, underlying cancers may increase your risk also. Number 5, diabetes and severe obesity with a body mass index of 40 or greater have been shown to increase risk of a more severe form of COVID-19 infection and even death. In fact, a recent study from China showed that patients with diabetes have an 8-fold risk of death with COVID-19 infection. We know that patients with obesity and diabetes have a weaker immune system, so it makes sense that they're more susceptible to infection. Knowing this, now more than ever, it is so important for you to get your chronic illnesses, especially diabetes, under control. Besides just increasing your risk for heart attacks, strokes, amputations, and kidney failure requiring dialysis, diabetes now also appears to increase your risk of death from COVID-19.